Welcome and good Wednesday morning, everyone. Glad to have you along here. My name is Randy Lober, Growth Marketing Manager here at Action Benefits, and happy to lead you through a bunch of today's conversation about Coverage for One, and particularly how it can make Medicare enrollments and Medicare appointments even easier, I guess if they are easy for you, than they might currently be. Joining me today is the incomparable Chelsea Gomez. Chelsea, I want to give you a chance to say hi to everyone before we go ahead and get started.
I always forget that it's not Chelsea Smith anymore. So I was like, oh, wait. But hi, everyone. Thank you so much for coming. While we show you some of the new features and old features that come with CoverageForOne, which is our awesome platform to help you with your Medicare enrollment. If you have any questions, please feel free to put them into the chat or the Q&A feature. And I'm here to add some color commentary and to answer those questions you have. So keep me on my toes. Give me something to talk about with y'all.
All right. Thank you for joining us here, Chelsea. We appreciate your time, knowledge, and expertise here that you'll have to share. But now the introductions out of the way, you know who we are. Let's also introduce you to the tool we're here to talk about here today. Coverage for One gets its start with the beginning of the implementation of the Affordable Care Act in 2014. And started off as an exclusively Blue Cross platform, specifically for both off-marketplace coverage. So, of course, healthcare.gov was always available for your big, detailed, long eligibility checks, so on and so forth. Coverage for One really became known as an exclusive private exchange where consumers who were looking for off-market coverage and agents who were looking to offer off-marketplace coverage could come, shop, quickly enroll. And if you know what you're doing, exactly what you're trying to get done on the off-market side, you can get an enrollment done in as little as 3 minutes, as long as you know exactly where you're going. I've timed it with a stopwatch. It works really well. Since over time, as the platform has evolved, we've also expanded its capabilities through a variety of partnerships. Currently here today, we're going to talk about our partnership with Sunfire. If you know Sunfire, you know Coverage for One. But I want to give you a tour to show you a bit about how it will make this AEP a little bit easier for you, especially amidst all the plan disruptions that we're seeing throughout Michigan and indeed throughout the country. Show you how to compare plans, show you how to shop doctors and drugs across plans, and really arrive at a price point for the full year that really fits both your beneficiaries' coverage needs and fits their budget. So both of those things are important here. So to get started, you can come to CoverageForOne.com, and then you're going to pop over to, you can use the Agent Tools drop down and click on Medicare up there, or you can scroll down and click on Medicare here. And when you do, it's going to bring you over to a screen that looks a lot like this one. Chelsea, I just want to verify that my screen did switch over with you, that I shared everything right. You're looking
It
at?
sure did.
All right, Coverage for One here at the moment. So I want to give you a quick tour of everything you can see here. There's a lot of things you can know, a lot of things you can do here. I want to make sure you're familiar with all of those before we show you how some of those work. If you ever need to come back to this home screen, of course, you can click on the logo here or click on the house button, the home button will bring you back here. A few other things to point out. Across the top of your home screen, you've got search contacts. That effectively, as you bring customers into Sunfire, it effectively serves as your Medicare book of business tool. You can really take a look at them, search them up, see where they're enrolled, if you have a valid scope of employment for them, so on and so forth. Quote and enroll does exactly what it sounds like. If you have someone sitting across the table from you, you can get working on that quote with them and for them right away. You can send scopes of appointment right from this dialog here. And you can also do some reporting on your book of business here as well. I should note that this is a training environment, so there is no book of business in here. It looks kind of sparse. Hopefully your books of business will look a little bit bigger when you log in. So I don't have any successful enrollments or any incomplete enrollments to show you over the last 30 days. But I do want to take this time to point out that it is indeed a training environment. And while most things work as they would when you use the platform live, not everything does. And I'll point those out and swear up and down where things do work, just so we can all be on the same page about that. The buttons on the left here will do much of what you see here on the across the top. So you can look at all your contacts. You can go to your quoting phase here. You can go to scopes of appointment. You can see reporting. So all those buttons are the same. Down here, though, is where we want to really start our tour in earnest. There is a help summit that gets you step-by-step directions on everything you want to get done. There's this notification center, which we'll show you the power of here in just a moment. But where I'd encourage you to start after you log in with the help of your Action Benefits individual account manager is your agent profile. It's going to control a lot of things that you, a lot of notifications you can get, and a lot of things that your enrollees, your prospects, your clients will see here as well. First, we always assign a username to you. It's based on the email we have on file with you. The password is created based on a special formula. And again, your account manager here at Action Benefits can get you connected with that if you do not yet have it. And you also have right up top here an RTS report. And those are the carriers that you have under action that you are ready to sell with. So you can generate a quick report of those that says, yep, I can sell these carriers. And if they appear on this report, the RTS report, they'll also appear for you in Sunfire here for you to quote and enroll. You can also add a profile picture. Highly encourage that, and I'll show you why in just a moment. You can edit some more information about yourself. So your first name, last name, your NPN. If you happen to work in California, because we are licensed in California, you could work with us in California too. You can put in your California license number here as well. We'll come back to personal URLs and Blaze Sync URLs here in just a moment. They do two neat things, but we'll go back up here in just a moment. You can choose how you want to be notified, whether that's email or via text. So whenever a consumer does something in CoverageForOne, maybe they've completed scope of appointment, maybe they completed their enrollment, or maybe they've messaged you to ask for a question. All of those things are things they can do here. You control how you want to be contacted. Do encourage you to update your work number and your primary number. This is the number that will be consumer facing on all of the plan shopping and scopes of appointment that the consumers will see. So I'd make sure that you update that. And whatever is selected as primary there is what your consumers would see for you. And you can also put an e-signature on file. It's as simple as clicking edit and doing scribbling, maybe signing a little bit more effectively there, and saving that signature here. What that signature does is lets me sign scopes of appointment, which is really nice when we have a batch of scopes coming in here during AEP. I'll show you how to apply the signature to scopes as they come in here in just a moment.
I always practice that signature every time I do this on my own, just because I'm always embarrassed to do that signature in front of everyone with your mouse pad.
I just have no fear. We roll with it. There's some other things you can control down here as well. So multi-factor authentication to keep your account secure. You can choose to use phone messages, push notifications to your phone, or one-time passwords. Any of those could work here. Here in the training account, we're not using any of those because we don't have any beneficiary information. But again, would highly encourage you to use that so your account stays safe going forward. I'm going to save the changes so that signature I just made gets applied to that. And then want to come up to really where you're going to start some of your workflows here, this AEP, or at least where I would encourage you to start your workflows. Your PURL kind of gives your consumers a full shopping experience. They can kind of lazily input drugs and doctors and kind of shop around plans on their own and so on and so forth. But the really powerful thing that Sunfire's done recently that makes it one of the best Medicare quoting enrollment solutions on the market is this Blaze Sync URL. I'm going to copy that here with the virtue of the button here. I'm going to open a new tab and show you why I love it so much. So a few moments ago, I said that you update your username, your phone numbers, and your logo here or your image. Because I did that or had done that previously, my picture or the Action Benefits logo here in our training account shows up here, as well as some information. It says call training your licensed insurance agent at that number along with your office hours. You can put those up. So that way, again, your beneficiaries can see that. You should also notice down here that your disclaimers all pop up down here as well. So really does a nice job of keeping you compliant when you're working with your Medicare beneficiaries here as well. What your beneficiaries, though, can start doing is putting in information on this client intake form. And so I'm going to give you a little bit of preview of what they'll experience here and show you why it's so great for you on the back end here. So they were born on November 8th, 1956, and with an email over. We're going to use your email address, Chelsea.
Oh
And
man.
they can put in a phone number here. And really what this does is serves as your consent to contact. So this will be on file for you. They're giving permission to contact you. That's great news. Compliance hurdle 1, check. Second thing we've got to do is the member's going to have the opportunity to put in their address. And what it's going to do is look for doctors and pharmacies in their area. I'm going to autofill Action Benefits address, but again, your beneficiary could use whatever information is relevant for them here.
That is one of the cool
Then-
benefits of this is it doesn't let you be non-compliant ever at any point.
Yes, absolutely. Throughout the whole process, it does script your process, and we'll show you what it does for you on the back end. But also what your beneficiaries can do is start putting in doctors if you so choose. And gosh, that's a great thing to have on hand during AEP. So if they were to search maybe their PCP, they can add that, they can check their locations here, see that that is in fact the right doctor and save it. Or they can add additional doctors if they so choose. And maybe the doctor shows up sometimes too. Let's try last name search. There we go. So we can set primary care doctors, we can set associates and specialists that we might see. We can save and continue, move forward here. The really cool thing though is if you get this in your client's hands ahead of time, is they can give you all your drugs right ahead of time too. So maybe they have asthma, they take the generic here for Advair. Maybe they take more substantial dose than is typically given, and they do refill that every month. We're going to save that notification. We also know that asthmatics probably have a rescue inhaler too. Maybe they're using albuterol, not for that. This is how you know it's a live demo, ladies and gentlemen. We can choose that. We can choose our dosage, choose if there's a specific generic working here, the refill frequency, save that medication, and maybe they are on something else here as well. Maybe it's a cough suppressant or something of the sort to help them get through some of those tougher days. We'll save that medication and continue. Then going to ask your members if they have a pharmacy that they prefer. So if so, we can put that pharmacy in. Maybe you do use Costco or Walgreens or probably not Rite Aid, Michigan. They might use something else. They can put that in here too. And that's important because on the back end, it's going to help us shop pharmacies, what's preferred, what's not, what actually has the lowest cost for your drugs. And that's cool. Last thing it's going to do is one of the probably third most helpful thing that this process will do is collect the scope of appointment for you. It walks the beneficiary through the scope process, asks them to start the process here, lets them choose, as it should be, what they want to discuss, lets them see the description of all those plans here, and lets them come down and says whether they're signing for themselves. I am October 8 sample. You can choose who they're signing for, the date, and it'll tell you and the beneficiary when you can have the appointment. Remember that 48-hour rule is in effect here. So it'll tell you that the appointment can happen on October 10th or later. And man, does that do a great job of setting expectations for you. So I've got all this stuff in here right now as the beneficiary. I can click sign and complete. And now the scope of appointment is complete, your beneficiary has a few options. It's going to let your beneficiary know that you're going to review their information and set up an appointment, gives them notice of the 48-hour rule, and they can start shopping if they want to here. I'll show you that shopping experience briefly. Not the key part of this demonstration, but it is an option for them. This is exactly what they would see if you were to give them, by the way, the PURL page. It would let them start shopping. They'd put in their zip code. It gets kind of redundant for them at this point. To be perfectly frank, your information still shows up here. But so I'd strongly encourage them to stop after they had filled out the client intake form, because it's giving you everything you need to develop a competitive quote for that client. So if that submission is completed, I'm going to clean out some of these junk tabs up here. Want to pause and see whether you have questions about that client intake form, or you're probably wondering, gosh, Randy, what happens when someone does complete that? I'll just refresh us real quick. There's a few things that happen. In the training environment, I remember we configured it to get emails. So Sunfire would have sent an email off to their email address that we asked it to let us know that someone completed this and has a scope waiting for us. I also see that this person both created a contact form and submitted their scope here in my notification tab here with that red button. That notification automatically clears. So from here, there's a few things I can do here with October 2nd. Right here in my contacts, or right here on my dashboard, I can click on the action page. I can view the contact, view the quote, view their scope, so on and so forth. Probably the first thing to do is look at that scope of appointment. What it allows me to do is set the appointment type, see whether the scope is completed, and the scope is not completed because it's missing one key thing. It is missing our signature. So all I need to do to apply my signature to that is maybe first I should view it, of course. Make sure it all looks right here. But all I need to do to apply my signature, either from here or the previous window, is click sign. If I scroll to the bottom, it does apply my signature that we completed here. I'm able to generate that as a PDF, keep that in my records, or keep it here in Sunfire for safekeeping for the remainder of this year plus 10 years. So really nice way to stay compliant, really nice way to eliminate some of the paperwork that might be floating around your office. Can't say enough good things about that.
Just another way, it doesn't let you stay non-compliant, forces you to be compliant.
Yes. So now that I have my scope complete, my scope is signed, I know that I can have it. So 2 days later, I can come back and look at my contact records. I can search for that contact here, or the most recent contact I was working with here was October 2nd. I don't need to edit anything about them, but I can add a note, for example. I can say they completed a quote, appointment scheduled for October 10th at 10 a.m. or write any other notes here I want to about that as well. My name comes in here as well. I can add additional notes. I can bookmark. I can add comments. So if you happen to have multiple people working your agency, or you are someone, again, just needs to take a lot of detailed notes, you got a lot of information, a lot of capability to do that here. But let's get to the scope is one thing. I also want to see, gosh, what can I actually enroll this person in? So I can go ahead and start a quote. There are a few things to point out here. First of all, because the time of the year we're in here, we have 2025 and 2026 plans we can choose from. I'm going to show you 2026 here just so we're comparing apples to apples. But if you are writing someone for plan year 2025, make sure you are looking at that toggle there. For 2026, there's a few ways we can get this done. I can start with what's called the customer lookup. The customer lookup is going to give me a really personalized view of that customer and give me some history. The zip code would just let me go to seeing all the plans. If I go to the customer lookup, though, it's going to ask me to read a small disclaimer to them, asking for zip codes, Medicare number, and date of birth. But remember, this person filled out that client intake form, so I've already got their zip code. I've already got their date of birth here on file. The only thing I need to collect from them right now is their Medicare number. I have a dummy MBI I'm going to pull from another screen here. If you just give me a moment, Chelsea, if you've got a good dad joke while I'm looking for it, you can give me one.
I just wanted to point out too, while we were talking about scopes, I don't know if you saw at the top of the screen there was a couple buttons for if you did want to do the scope in person with your client, that is also an option. I like that it lets you do it in multiple ways. You can do the scope right there in front of the customer. And or you can upload a paper version if you're old school and really like your paper versions of your scopes of appointment, or you can email and text it. The text one doesn't work in the training feature. I did try to demo it live one time. I'm like, oh no, it's just that it doesn't work in the training department, but I think the text one is super nifty. I know as someone who have parents who have done this process before, they really appreciated the ease of doing the scope text wise, since they were not interested in doing the Blaze URL thing we showed you earlier. That's another option if your client is interested in doing it kind of in the tech way, but not completely, they're not completely into the tech scene quite yet. It's a good way to dip their feet in, and then maybe next year you can get them on board with shopping on that PURL.
Absolutely, and we'll come back to some of those features in a bit here, just to show you some of those things that are left out of this current workflow that we're working on here. We'll loop back around to those. So if I've got this dummy MBI here, the beautiful thing about this is if I have this MBI, this date of birth and the zip code, I can hit lookup. In the training environment, this isn't going to work exactly as I want because there's no beneficiary that exists in CMS systems that matches those at the moment here. Were this a actual beneficiary, you would see their report from CMS come back. You'd see their current enrollments, you'd see their LIS level if available, and you'd see again what plans they were enrolled in here at the moment here as well. Gives you a lot of information about what you can do going forward. Then again, based on that scope, you're going to choose the types of plans you want to discuss for this customer. I can choose MA and MedSup just to show you a little bit about how it can help you with some MedSup underwriting. It'll also ask you if they are currently enrolled in a Medicare Advantage prescription drug plan. I'm going to say yes. I'm also going to choose one that is experiencing a bit of disruption here at the moment to show you how we can handle it here. This plan underwriting screen only shows if you have selected MedSup here. So if I say that they're a male, the date of birth doesn't come down, but if my date of birth is 10/08/1956, if I can type better. With Part A and Part B effective dates that automatically fill, of course, you can correct those as well. You can choose whether they have a GI right or not here at the moment and say their tobacco status here, as well as shop for an effective date. That's going to give me some flags a little bit later on about whether or not they might be eligible or not to get through underwriting for a Medicare supplement plan. Again, I can confirm doctors down here. So they say, oh no, I actually see 3 other doctors. You can search providers with first and last name and add them here. Pardon me. With plan usage, you can read this disclaimer and get a sense of how often they use the doctor. Rarely, occasionally, or frequently. It's going to price those into their estimated annual cost based on the copays and coinsurance available on each plan here. Medications, again, we can add if we so choose. But the intake form has already got that done for us here. And down here, we'll have some additional questions to answer about Medicare supplements. So if they're in an assisted living facility, it's going to tell us that Medicare supplement is not recommended outside open enrollment GI because it's not a great fit for them here at the moment. Are there any pending surgeries or treatment? Again, not a great fit for someone that doesn't have a GI right. If I have cancer treatments, I could have, that could be a knockout for some carriers. It would flag it for me here. If I had any ER stays recently, if I'm diabetic or use insulin or use more than 50 units per day, again, some plans may not be available to me here. Do I have any history of heart issues? Or do I have any COPD or require a nebulizer or oxygen? All things that could knock me out from a variety of Medicare supplement carriers. It's going to warn me here that some plans may not be available based on that. If I give them a clean health history, though, that error goes away. It lets me know that I have more options to shop for there.
Too bad it's not that simple in real life.
Right? I can also choose Some focus questions. Maybe it's important for them to absolutely to keep their current doctor. So that's super crucial for a lot of folks. Maybe they really like the OTC cards that seem to be dying out on some plans, and maybe they're frequent travelers. They want to make sure they have something that covers them if they go out of state. If I've asked all these questions, Ms. Smith, now I can show you some of the plans that are available in your area. So it's loaded plans, and up here at the top, it shows you your current plan. The current plan is always locked up here at top. If I do come back later on in the process and I need to make changes to their current plan, their pharmacy, their drugs, their doctors, all I need to do is click on that. It opens up a dialog for me to add more, subtract what I want to do from here. Here in list view, it gives me a few different options on how I organize these plans, and we'll stay here in list view for just a moment. We can sort by what Sunfire recommends to us based on the information we've put in here. We can choose our plan year, look at our cost expenses, and choose what we want to compare on. Generally speaking, you're probably going to do most of your comparisons on MOOP, drug deductible, medical deductible, but you do have the option to take a look at some of these other features for you here as well. It would change what you can see back behind you on the screen. You can see that's changing in real time, but we'll keep that here at the moment. Down my left-hand side, I can filter by plan type. I can filter by MAPDs, just PDPs. So I can shop for just PDPs using this platform. MedSups, just Medicare Advantage, any SNP plans that might be built for my carriers, and dental vision hearing packages here as well. I can sort by the features I'm interested in, whether that's 5-star rating, Part B givebacks, dental vision hearing, whatever's important there. If I want to make sure my pharmacy is preferred, I can do so there. If I want to make sure I'm choosing from only certain carriers because that's where they have an affinity for, or for whatever reason, that's certainly an option here. I can filter by, see are my doctors in network or not. If it's really important to keep their doctors, maybe we do want to keep that on. I can look at plan type and again, whether or not the plan has a deductible for us here going forward. For giggles, let's say that I am comfortable with changing pharmacies, but I need to have my doctor. I'm loyal to them. Changes the plan details for me here. So it does bring my current plan details up top, but it also rates some similar plans or that I could be interested in here for us as well. So I see the MOOP, I see the deductible, drug deductible premium, and annual cost. And gosh, that's a really important figure, especially for folks that are price conscious this time of year. So I can click on any plan. I can see what's available here, see the drug deductibles. I can see their estimated annual cost summary here. We'll show you those in just a moment. Says this plan allows out-of-network doctors. Both these doctors are written in here. If I need anything like star ratings, EOCs, or summary of benefits, I can access those here. But I also want to be able to compare these plans here side by side. So Ms. Smith, I'm going to put your current plan into comparison just so you can see what you have here in 2026. I also want to put the next available plan that has a fairly low estimated annual cost at only $828 compared to our almost $2,800. So we'll look at this plan from here from Zing Health, and we'll add that to the compare. And we know you want to go places, so HMOs probably aren't very helpful. So let's take a look at Blue Secure here for you as well, and we'll add that to our comparison. If I want to compare that, all I need to do is jump over here to the compare button. I'm going to get a side-by-side comparison of these, starting with benefits, moving down to drugs. I can see the actual cost calculations here. You'll notice that some plans are not available for electronic enrollment. Some plans are available for electronic enrollment. For example, because Medicare Plus Blue PPO Essential will not be commissionable for new business or new renewals next year. And Blue Cross has chosen to not make it enrollable here via the platform, but their secure plan, for example, is enrollable here on the platform. Zing Open Choice, we are in the process of finalizing some paperwork with them to make sure we can enroll with them, but it would be available for you here as well. So I've got side-by-sides of premiums, deductibles, MOOPs, I've got drug deductibles side by side. I've got initial coverage limit, which shouldn't change for anyone here. I've got all of my other costs here, additional services, chiropractic, all the way down. Anything you could ever want to know from an ANOC is all covered here on this screen. So I can deliver those all for our clients. If I want to see how drugs are covered into those plans, I can scroll down and see that that benzonatate is not covered in any formulary, so that's part of my drug cost. I see that, ooh, when I go to Zing Health, that expensive inhaler is actually a tier 2 drug, not a tier 3 drug. That can make a difference for me. And I can see that my full drug cost when I fill those is 46 because it's a tier 2. Not 119 when I get it filled as a tier 3 and other carriers. Shows me again what I would expect to pay for that inhaler here as well. And again, I'd get a month by month breakdown, show me when I'm in the deductible phase, when I'm in the initial coverage phase for each carrier, and when I'll have met that deductible and go forward. So I can scroll down all the way to December, for example, and see that I'd be in the catastrophic phase, and I wouldn't have much liability there at that point for those drugs going forward. Only just the drug that doesn't appear in any formularies, that benzonatate. So lots of good information here for you to keep. I also take a look at your health cost details. Again, it'll show you your estimated health costs based on the usage figures we put in earlier. So what it would cost for those 5 in-network doctor visits, what it would cost for an urgent care visit, $0 urgent care, that's pretty cool. Same for vision and dental. And again, would give me those kind of ideas here. If there's anything I want to enroll in right away, if it's available, I can simply click on the enroll button and do so. We should also point out that I can email this comparison directly to the client. Carries over her email that we put in earlier, has the plans here that we want to compare. All I need to do is click send. Chelsea would get an email in a few moments. She'd be able to open up that email. I can't send this because I'm in the training account, but she would be able to open that email. I would need to have this screen up so I can give her this personal number so she can unlock her quote when she opens that email. But so makes sure all the information is secure going forward, but really gives her a way to review everything side by side that we've taken a look at here so far. Really powerful tool. X-ray view gives you a little bit more view into plans here. You get all those plan details displayed for you. So pick your poison, how you want to see things. You get the entire evidence of coverage for you, laid out for you here. In addition to drug costs, in addition to pharmacies, and so on and so forth, you get your benefits laid out for you. It doesn't show you the current plan, only shows you the recommended plan here in this view. But again, I can filter down to drug, health costs, so on and so forth. But if we have made a decision, maybe because for whatever reason they're very blue loyal, they're not comfortable with Zing, we can enroll you, show you what that process looks here on the platform. Maybe we'll need to refresh, make sure everything works for us here. All right, we lost everything there. And that's kind of the bug of training platforms here. I'll just pick another carrier that has enrollment available and go from there. All right, so it asks you to choose a doctor. I'm going to just choose a doctor real quick. And we'll just save the provider here as that doctor. But the application piece goes really easy. It looks like any other application you might see. It's going to ask you to review the benefits and make sure you go through the monthly premium, go through that Part B give back if there is one, go through your deductible. You'll be able to check these off as you discuss them to really make sure your beneficiaries understand them and does you the added bonus of staying compliant later on. Gives you a copy of the summary of benefits you can put in the beneficiary's hand. It gives you a copy of star ratings, give you another copy of summary of benefits here, and be able to go forward from there. If they show they understand their benefits, you're free to go forward. Continue the application, give you first, last, so on and so forth. Again, the information got wiped out here in that little hiccup we had here in the training environment. But the application here looks like any other training application you might have. Takes you through date of birth, MBIs, all of these information down here. to get you through the process, whether you want large print material, so on and so forth. Again, because that information didn't stick here, I'm not going to waste your time and make you watch me put it back in. But I can tell you that if you were to go through and clear out the Medicare info, fill in plan details and submit that application does get over to the carrier right away. And you'll be able to track it here. So lots of good news for you there. If I did want to come back, and maybe that's the way we can do so, October 2nd was this year, the content we were working on. If I view her quote, just for giggles, want to see if enrollment will come back for us here. If I do want to enroll in this Blue Secure plan and click enroll, just to prove that information comes with us. Okay, can't enroll to the beginning of AEP. Can't take the app yet, but we've talked about it here so far. All right. What else do we want to see? We want to see, go back to our dashboard here. Want to walk you through some of those things that Chelsea had mentioned earlier about scopes of appointment. So for example, if I were on the scope of appointment tab, I could email a scope to anyone I was interested in. Again, I could text scope, complete the scope, or upload a scope. Should mention that when we complete the applications here as well, I can also email for a signature, I can text for a signature, or I can turn my screen around and have them sign here using the same kind of logic here where you saw me sign the signature pad earlier. I could have them do that on my laptop or tablet just as easily for the shopping experience. If I want to start a new contact, maybe I'm done working with October 2nd sample, you can see your active contact here. If I need someone new, all I've got to do is click new contact, and I'm off to the races, ready to start the process all over again with another beneficiary or another client if I want to. So all that said, ladies and gentlemen, I highly encourage you to go ahead and use that client intake form. If there is sitting someone across your desk, you can run through the same quoting workflow we just looked at by clicking on the quoting enroll button. If for whatever reason that needs to be done with you. But again, there's a lot of power in this platform, a lot of flexibility in this platform. Using that client intake form is going to make your lives go a lot easier this AEP as you're gathering new drugs and new doctor information. And the good thing is once it's there, it's there. So unless their information is changed or changes significantly, their doctors and drugs are always going to be here for you going forward. So as you get more clients into the platform, it gets easier and easier to use year over year. I do see a few questions. Does it show all available plans or just the plans you are licensed? It will show, to be real specific, Michael, it will show the plans that you are licensed and appointed under action for. So if you happen to have another upline for other carriers, maybe they have their own instance of coverage of Sunfire, you'd have to toggle over to their instance using this feature up here. Our trading account doesn't have another upline. That's how to accomplish that. But for your direct question, Michael, your clients will see only the clients that you have under action. So they won't be going to see anything that you don't have, right? We want to make sure that that you get paid for the work you're doing here. Also, I guess on that note, if I wanted to view plans while we're thinking about it here, and I wanted to view all plans just for giggles when I'm shopping. We also know that some MAPDs are non-commissionable, like this HAP Medicare Explorer or this Humana Full Access. It does very clearly tag those plans for you in the platform, so that you can make some decisions that make sense for both your beneficiary and your business here as well. Again, we don't want to steer anyone just because of commission, but we know you also don't want to work for free. So that is a feature we should point out to you here as well.
I don't know if you can see right there too, the star rating normally is available here as well in case that's something that your client is interested in. Oh, good idea. Yeah, so the ones from last year will show up on there, but because as we know, things are a little down the wire, there was no star ratings yet for any of these plans, so you will not see the 2026 ones in there quite yet, but they are there for 25, and I presume will be there once we have them.
Yeah, star ratings should come out this week. They should be published to Sunfire shortly thereafter. All right, ladies and gentlemen, so that is a top to bottom, kind of a quick and dirty workflow of how that client intake form can work, and then how you can take that client intake form and conduct a successful Medicare enrollment, shop around across all the plans you offer to really find the best fitting plan at the lowest annual cost for your beneficiary, and really taking care of your beneficiary, your client, is what it's all about. Chelsea and I are happy to stick around for any other questions you might have, or if there's any other things you can think of you might want to see, or weird things you might want to take a look at, we're happy to show you those too. But otherwise, ladies and gentlemen, we thank you for your time and attention. If you want to know more about how you can handle some of your plans that are being disrupted, like this Medicare Plus Blue Essential, like your Medicare BCNA Prime Value Plan, we have a set of webinars tomorrow that you are welcome to register for. Check your email for more information about those. All that said, Chelsea, any words for the audience before we say goodbye and good luck for the morning?
The only thing I can think of is, as someone who has been looking at Sunfire for a few years now, but doesn't actually, since I'm not an actual selling agent, I don't use it every single day. As someone who comes back to it every few months, revisits, gets myself familiar, shows you guys the ins and outs of it, I have to say, every time I log into it to go look at it again, to refresh myself before I train for this, there's always something new or something improved. Like, it's not if that helps you in any way to make a transition over to something new. I know it's scary to sometimes use a new platform. And you're like, man, I really am in love with X thing that this platform can do, or what have you. This platform is always adding something to make it easier to use, and to make it more fluid for yourselves. That Blaze URL wasn't a thing a couple years back. That got added. And every time I log in, I'm like, oh wow, that's a cool new thing. It didn't do that before. Or, oh, that's nifty. So if you are, like I said, if you're someone who's on the fence, not sure if that's something you want to switch to, I recommend it as all the stuff that I've ever used. Obviously, as I said, I'm not a selling agent. I'm not there every single day. But as someone who goes through these things to train people on how to use them, I truly think this one is the easiest to use, and covers you in not only in like things like just little things like that, like showing, oh, it's non-commissionable. You wouldn't know that until you looked there. And keeping you compliant, like I mentioned like 4 times, because it does not let you do anything to leave you in the dust compliance wise. It saves your scopes for you, forces you to say the things you need to say compliant. So it really takes a lot of the worry out of this process for you. And that's honestly my 2 cents about the whole product in general.
Might have got a whole nickel out of that, Chelsea. But thank you for sharing, and I echo everything you've said there. It does have a lot of value for agents, and like we said, it can make that whole process a bit easier. All that said, if you want to talk more about CoverageForOne or any other way Action can help you, we invite your questions at learning@actionbenefits.com. You can always reach out to our individual team at individual@actionbenefits.com, or reach out to either Chelsea or I directly if you have our contact information as well.